All right, welcome everyone to this beautiful spring day, the last day of March. A lot of good news to report on the way of financial resources heading our way, hopefully more doses heading our way, people getting vaccinated, people testing still very strong in the county, and hopefully more jobs being filled as people get vaccinated and we start to open up more. So I'll start like I normally do with the numbers. We're just almost at 40,400 now, with still a significant amount of cases coming in weekly. And unfortunately, we've had 3 more deaths this week, so we're at 547. And certainly, we can't wait to report the last case and the last death associated with COVID-19, and that day can come not soon enough for all of us. County update on the testing. As we continue to roll out the vaccine, we know COVID is still here, and as I'll talk about, we've got a great deal of the population vaccinated, but there's still as many people out there that are not vaccinated. So we have to keep that in mind. And we continue to test at one of the highest rates in the state, 745 per 100,000. There are 3 reasons still to get tested. Residents need to know if they're infected so they can stop the spread. That's where the contact tracing comes in. Testing lets us know whether the virus is mutating in our community, which is very important. And the testing continues to be one of the key metrics used by the state's blueprint for a safer economy that allows us to move to a less stricter tier. And that has been very, very important to getting to that less restrictive tier, and that has played a major part in us getting to orange. So we have 1 new site located at Red Morton Park in Redwood City at 1400 Roosevelt Avenue, and it's Tuesday through Thursdays, 8 a.m. to 3 p.m. And the county run test sites and hours can be found on our webpage. I can just tell you, we have a host throughout this county of test sites. If you can't find a test site, you are not looking, because they are virtually everywhere. And a credit to our folks who have put a ton of them up and out there, as this remains a very important part of our strategy. So last week we tested 4,344. In regard to the blueprint for a safer economy, the county metrics as of Tuesday, March 30th, the current tier changes were determined based on data from March 14th through the 20th with a 4-day lag. And as of yesterday, there are now 5 Bay Area counties in the orange: San Mateo, Santa Clara, San Francisco, Marin, and Alameda counties. The adjusted case rate per 100,000, 7-day average of daily COVID-19 tests per 100,000 people. As of the 30th, 2.0, which obviously puts us in the orange tier, and that may change depending on the vaccine rate achieved in this state. The unadjusted case rate is a 4.0, which has gone down, and so has our adjusted case rate. The positivity rate is at 0.9, which has remained the same from the previous week. And our health equity metric is at 1.4%, which has gone down, I believe, from 1.6% the week earlier. Vaccine allocation and changes to the state's blueprint. As I alluded to just a little bit earlier, on March 4th, the state modified the blueprint for a safer economy to lead with opening activities when vaccines have been deployed to the hardest hit communities. The modification will shift the blueprint tier thresholds to allow slightly higher case rates per 100,000 population once more vaccinations have in fact taken place, and allow people to move to the less restrictive tiers. And these modifications were made with a minimum of 2 million doses, mostly impacting those in the purple tiers, but in the future here, it'll be updated again when 4 million doses have been administered. And that's very important to this county, because when we hit that, we're right on the cusp of that case rate at 2. We should hopefully hit 4 million very soon in this state, which will allow us to get to that 2 and move into the yellow. In regard to the third-party administrator, I did have some questions about this earlier in the week, but I did in fact sign the MOU with the state. Again, it's not with Blue Shield, it was with the state. The agreement gives the county the flexibility in distributing vaccine to community partners and additional time to transition notification and appointment scheduling to the MyTurn platform. And that was key, right? That's why we delayed and didn't jump on the bandwagon right away. We wanted to evaluate this. We wanted to work on it with our other counties throughout the state and our legislators to make sure that this was not prescriptive in nature, that told us a certain way to do it, that we had the flexibility that we had before, because we do believe as a county that we know best where to get these vaccines and how to distribute them in a meaningful way, especially when it comes to the most vulnerable neighborhoods. And this MOU allows us the flexibility to continue to do that. Vaccine update, the information is good. So as you all know, eligibility tomorrow on the 1st goes to 50 plus, and then 16 plus on April 15th, just a few short weeks away. Now, what that signals to us is that there's more doses on the way. And we do believe that to be the case. Our allocation really has changed, has been unchanged from last week. We had 20,800 last week to 20,930 this week, which is virtually the same. But we do hope, and the state has indicated that those doses will increase exponentially here in the near future. We are poised for that. As you know, we have been operating in the communities that are most vulnerable in East Palo Alto, in Bellhaven, in North Fair Oaks, in Redwood City, in San Mateo, in South San Francisco, in Daly City, and out on the coast, which has really allowed us to address in a very targeted and specific manner the spread of COVID in the most vulnerable communities. We have established that pipeline. We will continue that pipeline as the doses ramp up, and we will restart our mass vaccinations at the event center and at SFO. And we will plan on doing at least one mass vaccination event at the event center next week, while continuing to feed the pipeline in the most vulnerable communities, which has been very important. So as of today, we've reached 283,711 individuals have been vaccinated with 412,000 doses, which represents 44.2% of our total eligible county adult population. So we can see from the data dashboard that 112,000 residents 65 and older have been vaccinated so far. This is 86.7% of this group. And of our residents 75 and over, we have vaccinated 90.3%. All great news, as we know that that population was also exponentially hit with COVID, and many deaths occurred. And the vast majority of deaths have occurred in those age groups. San Mateo Medical Center last week, SMMC successfully vaccinated approximately 725 patients at the Fair Oaks Clinic. This number includes a successful large-scale event that was held on Saturday, on last Saturday, which was great to see. The neighborhood people could walk there and get their vaccines. There was long lines at the beginning as people got in line and waited, but as soon as we opened, those lines went away relatively quickly, and those are becoming more streamlined, and we will continue to streamline those as we look at the different challenges of every site that we go to weekly, and then make advances on that. Larger scale efforts continue at the main campus, vaccinating 500 plus patients per week. A clinic is scheduled at this location for Saturday for 3, and if supply allows, the projection is to offer 750 vaccinations. So larger clinics are also planned at both South San Francisco and Daly City clinics, with anticipated volumes around 600, and those are very targeted also. So that's all good to hear. The in-home support services, IHSS, provides providers. So the 2,900 of IHS workers residing in San Mateo County have been vaccinated, which represents 54.3%. Correctional health, total 403 vaccines to all adult inmates and eligible youth inmates were offered vaccinations. Homeless shelters, and this is really good news here. All staff and residents of homeless shelters have been offered vaccinations. Over 200 shelter residents and almost 100 shelter staff were vaccinated, and efforts are underway to vaccinate the unhoused homeless. So we continue to make progress there, which is very important. The community-based pods and HR support, community vaccination events were quite robust last week. I think we did 11 community events. There were a total of 2,438 first doses administered at those 11 county and partner operated community vaccine events in 7 different communities with low HPI scores. We were able to successfully pilot the use of the state's My Turn registration system with 85 EPA residents, and there were over 1,500 second doses administered in North County and on the coast, going back to the farms. And I just got to say, and I mentioned this before, that you almost have to be an MIT mathematician to really understand and really work through how complicated allocating second doses is, and timing that up in a way to make sure that you always have that supply there and people are vaccinated on the date that they are supposed to receive that vaccination. So far, we have not missed a second dose clinic. Very proud of that, and all credit goes to health for really managing the doses in a way that allowed people to get their second dose on time, which really, I think gives people the encouragement to go ahead and get that first dose, knowing that that second dose will be available to them when they need it. The Merit Clinic for Education, Childcare, Food, Agriculture, Moderna vaccine, in the San Mateo Event Center, almost 9,000 received their second doses. So that was incredible. Last week was incredibly busy. So the Merit Clinic for Phase 1A and Phase 1B, San Mateo Event Center, Pfizer vaccine in partnership with Dignity Health, over 6,000 received the second doses. So the FQHCs, community clinics, county health provides vaccine to federally qualified health centers and community clinics like Ravenswood, SMMC, and Gellert Health. We also provide vaccine to Stanford, NIMS, Ravenswood, now receiving some vaccine from the federal government also on their own. But so not only our supply are we getting out there, we're giving it to our partners to make sure that they are getting it. Just some more updates, because we think it's important for you to be fully educated on all that's going on in the world of vaccines. The CDC Pharmacy Partnership for Long-Term Care Program, the data from the federal Long-Term Care Partnership Program with Walgreens and CVS as of 3/28 lists 384 facilities of all have been completed their first clinics, and 379 or 98.7 have completed second clinics, with 67.4 having completed third clinics. So 23,573 doses have been provided to residents and staff in 384 clinics or facilities, 384 facilities. 47.1% to the residents and 52.9% to the staff. So we're actively following up on with 119 additional facilities which were not part of that program to determine how and when they will get the vaccine. The partnership with HPSM to vaccinate eligible HPSM members at in-store Safeway Pharmacy continues. The week of 3/22, 515 total vaccinations in 6 clinics across 3 locations took place. This week, 9 more HPSM clinics and planning for the future clinics also with HPSM. The Federal Pharmacy Partnership now has 9 brick and mortar pharmacies in San Mateo County directly receiving federal vaccines, basically CVS and Rite Aid. We now also have 15 Walgreens sites in San Mateo County receiving federal vaccines. So all that is good news. You're going to see there's going to be many in the weeks to come, many, many, many different ways to receive a vaccine. And these are just some of them that are up and running now. Current vaccine events, as I indicated last week, we had 9 community events in addition to 2 partner-run events in 7 communities. And this week, we'll continue to operate in the same light with 9 community events in 5 communities across the county. On April 1st, tomorrow we'll have one in Daly City and Ravenswood. On the 2nd, in Daly City, South San Francisco, East Palo Alto, and Redwood City. And on the 3rd, in San Mateo, South San Francisco, East Palo Alto, and Redwood City. So a lot of great stuff going on there. Great Plates is going well, still going gangbusters. And just a reminder that we have Passover and Easter coming up this week. So this is not the time to let our guard down. We have half the population almost vaccinated. The other half has not been, and we are trying to avoid a surge. We need everybody to do their part now and sprint through the finish line to get us to yellow. We're on the cusp of getting there. There'll be more openings, more jobs, more people back in society earning an income which they desperately need to pay their bills. So with that, let's see if there's any questions. There are 2 submitted questions. Has the state certified what changes may be made to the tier reopening system? We talked a little bit about that. If we reach the 4 million, we will receive a little bit more relief in the tier system. For us, it'll bring the tier down to 2 of the adjusted rate, so per 100,000. So I don't know if Sarija has more on that.
That's what we know at this point. There's information on the California Department of Public Health website about this overall California rollout to get to 4 million doses that will have some adjustments in the thresholds for the tiers. We also know the state has issued guidelines for activities such as graduations or other activities that are being planned in these spring months to try to maximize safety.
Great. And Sarija, the next one's really for you. Will the county begin lobbying the state to permit vaccinations of children ages 12 and older now that Pfizer doses have been proven effective and safe for the age group?
We did note the news that Pfizer released about the study. Typically, we look to the federal and state scientific review bodies to make recommendations about eligibility for a vaccine based on age or other criteria as they study the scientific data.
Great, thank you for that. Let's see, Miles, are there any other questions?
Yeah, we've got 2 hands up. Astrid had hers up first, and then Henrietta.
Astrid, good to hear from you. Hope you're doing well. Your question?
Hi, Mike. Hi, Srija. Thank you. I have 2 questions. So my first question is, if the vaccine supply does not increase in the next couple of weeks, will San Mateo County be able to open up eligibility on April 15th for everyone as the state plans?
Let me answer that. No, we don't have. I mean, we're going to need more doses to really be effective at this. It's all it's going to do. I mean, it could be open, but will they get it remains a mystery, because all it's going to do is create more frustration if we have several 100,000 more people that are eligible without the doses. We hope that won't be the case. The indication is it won't be the case. So we will hope for the best there. Sarija, I don't know if you have more on that.
I mean, the only thing I would say, which I think has been confusing to the public, is the eligibility expansion has not been timed with changes in supply. We think it's hopeful that eligibility expansion will occur, as Mike said. And it is a statewide eligibility scheme now. While in the earlier months, counties might make different decisions, as the state unified administration, everyone in California who's 16 or older will be eligible come April 15th, but it's always as supply allows. And for any local community, as Mike relayed, we hope to reduce the frustration of folks becoming eligible, but not being able to find a pathway.
And actually, you can see that we have made great progress on the 65 and older and the 75 and older, while also balancing all the other things that opened up in between, with food workers and transportation, and police officers and emergency management, everyone else in there. We've tried to balance all those needs while still trying to really focus on the populations that are most vulnerable. And that's why we're also in these neighborhoods right now, really trying to focus on the neighborhoods where we still see COVID spreading.
Thank you. And my second question, does the county have the power to open up eligibility in like certain areas? Because for example, one of the state senators requested that the state, for example, open up eligibility in like East Palo Alto, like a vulnerable community before the rest of areas. So is that something that's possible? Is that something the county is thinking about even?
Yeah, I think that is possible within the framework of the MOU. I think that we do have the flexibility to do that in a kind of a closed hub type of area. If we do see a particular area that is in need because of the spread of COVID or because of the vulnerability of that community, we do have the ability to do that. And we've talked about doing some of that. Sarija, do you have more on that?
And it's really focused on the lowest HPI communities in which that flexibility is afforded to counties.
Henrietta.
Yes, thanks so much. Mike, you mentioned that the county signed an MOU with the state. So does that mean Blue Shield is completely out of the picture as far as the county's concerned?
No, not at all. I mean, we have a great partnership with Blue Shield. They are the third-party administrator with the state. We work with them daily. And we do have that great partnership. It's just that our direct MOU is with the state. We understand that Blue Shield is the state third-party administrator on this and working very closely with the state and the counties. And we totally respect that. We wanted that direct link with the state, or that relationship with the state, and we've achieved that, but we're also, certainly in partnership with Blue Shield.
I have two more questions. You also mentioned that the vaccine was offered to inmates, and I noticed you said offered, not given. So does that mean the inmates had an opportunity to decline? And if so, what does that mean for the rest of the inmate population?
Yeah, I mean, a good question. As you know, we're not forcing anyone to take the vaccine. We are encouraging everyone, and we would hope that when the opportunity presents itself that everyone gets vaccinated. But not everyone's availing themselves of that. I don't have the numbers of how many people, accepted or declined it, but it's something that we're encouraging everybody to get when their opportunity presents itself.
But given how COVID, the virus, kind of severely affected the inmate population.
Yeah, I mean, it definitely makes it more challenging for corrections to, maintain a healthy environment. And but they've been doing a very good job of that for over a year now in San Mateo County. And all those protocols, regardless of the vaccine or not, are still in place and will remain in place to safeguard everyone that's incarcerated in San Mateo County.
I have one more question. I heard a doctor today talking about how the antibodies that are created from the vaccines last only so long, and given the mutations that are occurring, it's going to be necessary to issue booster shots. So this is kind of getting ahead of things. Has the county started talking about booster shots?
So when you start talking about antibodies, that's definitely Sarija. So I'm going to turn it over to her.
Hi, Henrietta. Our public health team certainly is following the science, and the scientific leaders, the clinical leaders and the pharmaceutical manufacturers are actively working on boosters as they see what is happening with the mutations, what's going to be necessary to keep everyone safe. There are different, scientists who have been talking about which are the populations for whom a booster might be most necessary quickest. I think in the oldest population, that might be in the coming months where boosters are targeted. But the science is really evolving on this, and we stay advised from the federal and state leaders who are engaged with the scientific community.
Thank you.
Great, thanks, Henrietta.
Great. We have two questions in the chat that are both sort of related. The first is a Bay Area group of legislators announced that the county will be getting $750,000 to expand vaccine infrastructure. We're wondering if there's any idea how that may be used. And a follow on to that was, do you believe that this $750,000 total adequately addresses the disparities that have been left out of the state's vaccine equity efforts?
Well, no, it doesn't adequately address it, but look, every bit helps. And what we'll be using this for is to offset the cost of operations and outreach. And we want to do very targeted outreach and hire more the local CBOs to help us with that. And certainly this will help with that. It's very labor intensive when you're working in a community to try to really get a specific area vaccinated, because you see the impact that that community is suffering. So it's very labor intensive. It takes a lot of people, and our people now magnify that all over the county, 11 different locations, and different times, different dates. And then we need folks at the sites themselves that can work there and operate. Not only, certainly the vaccinators are one part that we mostly will contract with, but really the volunteers or people that we have to pay to be there to help guide people through the line and get them registered and all those different things. So the money is welcomed, absolutely. Does it make up for the fact that we were left out of the doses? And quite frankly, the doses are more important than the money right now. If we did find, if we had more doses, we'd find a way, money or not, to get it done. But what we really need to stay focused on are the doses. We'll figure out the rest and make sure we get them in the right arms. But we're just looking for those doses to start flowing.
Great. Those are the last two written questions we had, and we have no more hands raised. So with that, I think we're at 2 o'clock.
Okay, listen, thank you all for being with us today. We really appreciate it. Everyone stay safe. Have a fantastic weekend, and we'll see you in a couple of weeks. Take care.